We run a outpatient facility with extended hours, 360 days a year we're open. And really, it's all the features integrated into a operations that is particularly useful for family medicine. So no, there's not one module or feature that's particularly good. It's the flexibility of all the features and the interaction between different modules of billing, scheduling, faxing, prescription management, refill management, etc. The selection process started in late 2000, went through 2001, and the process had to do with the typical, the champion leader, myself and another doctor, looking at various market forces and coming down to the choice of e-MDs due to its forward-thinking integrated module, its single database without bridging and other interfaces, and a strong practice to business to comprehensive orientation that e-MDs has had. The economics of it, they looked intimidating at first, the hardware costs, the software costs, but it really looked like a very useful business partner back in 2001, and that's what we invested in, and we've been very pleased ever since. We had targeted a 2 to 3 year ROI, return on investment, on the actual tangible costs of the system, software, and training. What we found was, on an optimistic viewpoint, I had an ROI in 17 months with our group. On a more critical, when I presented it to my colleagues, okay, maybe it was 21 months, but it was the 17 to 21 month on the actual ROI. The keys for our group were, we were not very good coders back then. We gave away a lot of things. We lost a lot of supplies and coding opportunities. And not only did e-MD's software help us capture that, it made all of us more aware of the nuts and bolts of what we do each day, because we see it on a screen rather than barking an order and it kind of disappears into air. So it was multifaceted, the better than expected ROI, but those are the major pieces. Well, we had a clinic that started its operations in 1965. The clinic had 60,000 paper charts that occupied the space of a 2-car garage when we went electronic. We were a cornerstone that's operations couldn't be interrupted, and when we went electronic, the point of conversion from paper-based to paperless was a huge, daunting task. Advice, flexibility. When you have multiple providers, multiple workers, you need multiple workflow scenarios. Everybody doesn't have to do it exactly the same or exactly on the same time frame. But deployment and phase-in needs to have definitive time and carrots, some carrots to drive people along through the occasional discomforts. Training, cross-training, very important. I really think providers need to have some training in billing. I think it makes them understand what makes the operations and the business move. I think providers need to know how to make an appointment. Even if they never do it again, they need to see it. So training and cross-training. So I think a tendency is to have medical assistant, nurse, doctor train only on chart, and then vice versa for the other departments. I think that's a mistake. I think we should cross-train. The visits to clinics. We often visit when we're looking at software, when we're looking at choices to help make the choice. A visit should be repeated to the one you've already chosen a week or two before your training and your deployment to get it fresh on your mind, the process and the thoughts, and get screens visible. So those are the basic pieces.